is Weekend Work on Shade 45.
Play Shade 45 is the Bad Boys of Radio. Coach PR, DJ Love Dinero. You know how we do every Saturday. How you doing, Love?
Weekend Work, man. How you doing, man?
It's Weekend Work, man. Bad Boys of Radio, man.
Working on the weekend. Working on the weekend as usual.
Working on the weekend as usual. This time we have a special PSA though.
We definitely do.
Special PSA for our people that's listening up early this morning, Saturday, Sunday. You know how we do right before Hookah comes on. I have a special guest, family. My brother over there, you can see the resemblance and the size of our dome piece. It's my brother over there, my younger brother, Cletis Earle.
He's more cooler. He's more cooler than you, you know.
Yeah, he's more cooler. He's a senior vice president and chief information officer at Penn State Health and Penn State College. That's thank you for joining us, Cletis. And Cletis brought a special guest over there, Doc. It's Dr. Robert Lennon. He is the MD, Associate Professor of Family and Community Medicine for the Department of Family and Community Medicine at Penn State College of Law. Am I right, Doc? And also a professor, a scientist. He's got the cure for the corona, they said. He's going to help us out right now. Is that true, Doc?
It's not true that I have a cure, but I do hope I have a way to get better outcomes.
You're going to help us out, Doc? You're going to give us some information, you know, because a lot of people are being misinformed out there, Doc. And, you know, this is why I said to Love, I said, we just have to have this PSA for the people out there. Series do cover a large amount of the country, of the world. So this could help out a lot, bro.
It sure could, and you are exactly right. The misinformation out there is terrible. There's a lot of it, and it is devastating. We see that now in the terrible disparity in outcomes. There's of course everyone listening here knows about historic injustice and ongoing problems with that. But we're talking today just about information alone. I can't go into downtown Detroit and build a hospital tomorrow. But at least we should be able to get you information on how to protect yourself and your community. And the data that we have says that we're not doing it. And that's why so many people are getting hurt.
And how do we go about that? Because everybody thinks that we could just, you know, put the mask on, keep our hands clean, and put the gloves on. That's going to actually help stop right now. But are there other things that we could, you know, be taking it more serious to do?
So those are absolutely the spot on things. The fancy term of social distancing, it really just means making sure that you're not in other people's space. If they have this disease, you're not going to know it. Most of the people that have this, they have no symptoms. So when they cough or sneeze, that disease gets out in the air. And if you're there, you can pick it up. So doing those things will definitely help. The problem has been early on, that information alone, just protecting yourself by social distancing, that information was not getting to everybody. It was getting to some people, but it wasn't getting everyone. And there was even groups, as you know, that were told African Americans couldn't get this disease. That misinformation
You said that at the beginning.
Yeah, that was the beginning. And it wasn't said that it was airborne also. So it was like, we couldn't get it as being an African American. We can't get it. Black people can't get it. A lot of people were saying that. A lot of people was just still giving handshakes. And now it comes out that a lot of African Americans are actually getting this virus. And, you know, people are saying because the states, you know, a lot of states, cities that we live in, we're on top of living in projects. We live in these buildings that's clamped together. The elevators, it's just so much. Imagine how much virus on just an elevator buttons alone and stuff like that. Like, it's just maybe, is it because the neighborhoods that we're living in, or it's not because we're Black we're getting it? No,
it's not because you're Black. It's partly because of the neighborhood. It's partly because that close living quarters does that. We saw the same thing on the Navy ships. You have a bunch of guys on a Navy ship, you can't really social distance. Except that if you really understand the disease, if you'd gotten the information correctly, you could have. So instead of having 8 people in the elevator, you could have had 2 people in the elevator. You could have known right up front, well, gee, if someone's sick, they can't go outside the house. That social distancing meant including from the people down the hall. So it's you're kind of trapped in your apartment, but you can't have play dates with people down the hall. That information didn't get through. And in my opinion, it's because the way information is put out, it essentially goes to the CDC website. If you're not a person that goes to the CDC website, where do you go? And if that place that you go doesn't have the same information, you're going to have bad information. That's what we're finding out. That 2 weeks ago, Oprah Winfrey talked about how she had found out about the higher risk groups, and she hadn't known about the higher risk groups. And I thought to myself, This is one of the smartest, most well-informed women on the planet. If she doesn't know that, then this idea of two different worlds, of two different Americans is clearly true, but we can't even penetrate it with information. That's the easy part. We should be able to get the information out. You should be able to have this information in your hand.
Yeah, and
That's
one of the dynamics here, I'm just a pleasure to be, in collaboration with Dr. Lennon, not only a medical doctor and a researcher, but a lawyer, right, a JD as well. It's tying with really smart people to say, okay, how do we then change the dynamic, knowing that it's really impacting communities of color in various and really impactful ways, particularly in hotspots like New York, Chicago, New Orleans, Detroit. Now you're seeing that influx in Atlanta and also in LA. So what do we have to do to get to our communities, right? To make sure that we stop some of the misinformation. And I have to, we partnered with Dr. Lennon, who's done amazing work creating a survey to learn more, learn what's happening. What are people seeing? We created a survey with Dr. Lennon's help, creating a survey, and it's very easy to get to. It's all anybody has to go to is covidsurvey, COVID survey.psu.edu. And we're asking people to just take the survey, take a few minutes to take the survey so that we can continue to learn from where those disconnections are occurring around, not only in this country, around the globe, and then be able to fight it next time, because let's not kid ourselves. This can happen again, right?
Of course.
And shame of us if we're not doing something about it. So we're asking people from all over the globe and with channels like you guys, Dinero and yourself, Coach, to say, how do we get out to our community and say, look, take this survey. We partnered with some really amazing companies such as Chime and Genesee. We're really working together to try to fight this battle together.
What is this survey now? Okay, me as African American, I'm listening to the radio show. I go on a survey. What's that do for me now? I did the survey. Now what?
So that's a great question. What it does is it tells us what you know, how confident you are in it, and most importantly, out of that, where you want to get your health information. And if they say we want to get health information from weekend work, then we know we have to tell the government, hey, CDC, you put this information out. It's not enough to put it on your website. You have to get to weekend work. You have to go where people want to get this information. And when they put it out, they can't just throw it at you. They have to talk to you about it. And if you have a question like, boy, you said social distancing, well, what does that mean when I live in a project with 400 other people? How do I social distance in there? It's not enough to say those words. You have to get into how does it translate into the community? You tell people work remotely. Well, if I'm a janitor, I can't work remotely. I can't do that.
Exactly. Right. Exactly.
They told us to work remotely, and I said, I can't do a physical exam remotely. I got to put my hands on the patient. And if we don't get that part of it down, it's just going to be ignored. So what does it do? It gives a megaphone to people who are not heard to tell the government authorities and the health authorities, this is how we need to hear the information. This is where we need to get it. And once we do that, in my opinion, we can compel action. We can say this has to come down. Now, does that build a hospital? It doesn't. But it makes sure that these simple things we could have done 2 months ago, those simple things we are able to do going forward. And it's particularly important because we're coming into this phase of reopening. Well, how do you reopen? What does that mean? Does that mean everyone can go to the park, or does it mean some people can go to the store? If we don't have that, that communication channel up, we will see a big spike in cases again.
Right.
And that's what we're trying to avoid. So immediately that's what we get. We also get another thing out of it. We're asking people to put answers to some of these questions in their own words, a free text box about their thoughts and feelings. And what this is doing is writing a story of COVID for all people. So we hear about it. You see the media people on there, they're hiding in their houses and their mansions, whatever else. What about everyone else? The rest of the people? What was their experience? That's an important story to capture. It's an important story to study and talk about. Something that people that study culture, how do cultures interact? How do neighborhoods grow? How do they interact? That kind of free text answer, that's going to help us for generations to come.
Yeah, powerful. And Coach, I'm looking at your face and I see that you haven't been to the barber. lately, right? You haven't been.
Right.
Those places are closed because those are places that we would normally. Those are places we would normally go, right? To share information and get that data. But guess what? When we're in quarantine, we don't have access to that. So we have to figure out different outlets, getting this information to our community so that we can do everything that Dr. Lennon just mentioned. And then we can change the dial. Well, this is a scenario that we can actually do something by taking 15 minutes to take this survey. We can do something about it.
Okay. And definitely the barbershop is that back in the days, they used to have the cross symbol. So that was it, the place to, get healed and speak to.
Absolutely.
But my question, and I know me and Love had this discussion before, like a while ago, to the doc, is that you're a scientist, right?
Yes, sir.
If there are people saying that this is man-generated, what do you say about that? This virus?
Well, the unfortunate thing is, we are never going to know. It's not possible to find out for sure. The very good news is that when they look at, so these viruses, they mutate over time. And what that allows you to do is look at, it's kind of like a genetic chain. You get to see how they replicate over time. And as they look backwards, you can see what are the parts of it that look like a normal natural development, and what are the parts of it that look like someone manufactured it. What it looks like, the people that do this kind of stuff for a living, it's not my area of expertise, but the people that do that for a living say, this actually looks a whole lot like a naturally produced virus. This looks an awful lot like it developed in an animal model, so probably developed in bats, and that somehow it jumped to people. I think the concerning thing is I think it's a legitimate concern, and I think you have to ask, was this man-made? Without question. I think the next question, though, is let's say it was natural. Well, where did it come from? Did it really come from species to person in a wet market in China, like they said? Or did it escape from someplace that was studying it? We don't know the answer to that question. When people ask that question, they are bashed about it. I guarantee you, I will get bashed for saying this on TV. They're on radio. They're gonna hammer me for this. But the reality is, we don't know. It is dishonest to say those are bad questions. They're not, because we don't know.
Right. Okay. That's fair enough. That's fair enough. If people tell, when you hear that, they say no, like, how do you know that? That's weird, those things, But, so, hello? Can you guys hear me?
Yeah, we can hear you.
Okay, because it flashed up. So now, moving forward now, so we get this message out, and you guys let them know where we can get the survey, where you can do the survey.
It's covidsurvey.psu.edu. Again, it's covidsurvey.psu.edu.
Right. Love, will you be taking the survey, Love?
Yeah, I'll take the survey.
Appreciate that, Love.
we gotta help each other. We need that information, so we got to put it out there.
Right. I just been waking Love up over there. You know what I'm saying? To make sure he's on his toes. That right there.
I'm just listening. Like, he's saying some very interesting things. So I'm just listening.
I'm glad that we can put this PSA out for the people to actually do this and help each other out, man. So I want to thank Cletis, thank you, Dr. Lennon. Appreciate you guys for joining us on the weekend work and helping us get this fight this COVID.
People, man, fight it. We got to beat this.
That's right. Knowledge is power. Thank you, gentlemen.
Knowledge is power. Thank you very much. Appreciate you guys. Thank you.
Thanks for having us. Take care. All right.
The Bad Boys Radio.
Bad boys, what you gonna do?
They're taking over the airwaves, so turn your radio up. Weekend work is now on.